Good. Good evening, everyone. As lawmakers, we are faced with important, controversial decisions that could potentially impact the future health of our fellow Americans as we know it. However, as far as nutrition goes, it is only ethical to support policies that are scientifically sound, especially when dealing with the health status of our children. The Healthy Hunger-Free Kids Act was started with these future generations in mind and was based off of these scientific recommendations and is something that deserves ultimate consideration, especially in today's political atmosphere. By utilizing a $3.2 billion budget to advocate for more whole grains, fruits, vegetables, low-fat milk products, and less sodium and fats in overall school meals and a la carte items, the act is in essence a reformation of the National School Lunch Program that was adopted by President Truman in 1946, but this time with more of a focus to combat the current obesity epidemic that has swept our nation, with rates tripling in children since the 1970s. After its passage in Congress, this law was originally signed by President Obama on December 13, 2010. With this law came not only a guarantee that school meals would meet the standards of the American Dietary Guidelines, but an attempt to tackle the persisting issue of child hunger in schools through the expansion of universal meal service and direct certification to receive free or reduced price lunches, depending on the eligibility of the particular student in the community, of course. Additionally, in an effort to minimize the financial burdens of the school districts, the Act calls for a 6-cent per lunch reimbursement as an incentive for schools to comply with these regulations, which has proved to be very constructive. Ever since this implementation, school districts have seen positive results in terms of participation. A study conducted by the Harvard School of Public Health as part of an analysis of plate waste that was conducted prior to and after the standards found that fruit and vegetable consumption increased by 16% and 23% respectively, indicating a positive step towards eating healthy within the school environment. Additionally, around 90% of schools nationwide have complied well with these standards, indicating that the goals behind the act have been feasible. Unfortunately, though, it is likely that the progress this nation has made in terms of adhering to our nutritional standards and giving lower income children the nutrition they deserve in order to thrive academically could be deterred. As part of a plan of action for President Trump's first 100 days in office, Representative Mark Meadows is advocating to effectively repeal the act altogether, according to a recent report in 2017 by the Washington Post. He describes the legislations under the Healthy Hunger-Free Kids Act as burdensome, and explains that there is not enough child participation in this program to the point where the food wastage is putting a financial burden on American schools. This action has not been taken as of yet, but the legislation continues to remain under jeopardy. It is important to acknowledge that some children could be deterred to eating healthy foods due to their taste, but current research that has been conducted contradicts some of these claims made. The Robert Wood Johnson Foundation, which is a nonprofit aimed at promoting a more healthful culture in the United States, had the opportunity to do some research on this topic 3 years after the act was implemented, through surveying school nutrition directors and service directors that represented various school districts in Connecticut, Washington, and Texas. The results highlighted a school revenue increase in over half of roughly 500 officials that were surveyed, and around 30% of revenues in these districts staying at level. It also reflected the increased participation of students in these programs, indicating a possibility of improving their nutritional choices and overall health status. It is evident that the Healthy Hunger-Free Kids Act is something that should not be ignored in our society due to the impacts it has had already. Please join me in support of keeping this act prevalent in our society. Thank you.